Welcome to the Tech Egg. Don't get scrambled. Enjoy the video.
You begin by confirming signs and gathering supplies. That saves time and reduces stress. Inspect the ear gently. If you see dark, crumbly debris or smell a mild odor, proceed. Put on gloves, wrap the cat in a towel to limit movement, and have treats ready for reward. Use a cotton ball to wipe loose debris. Do not push deep into the canal. Once the surface is clear, prepare the prescribed ear formulation, checking dose on the label so you apply the right amount. You now apply the medication exactly as instructed. Dosage matters because underdosing prolongs infection and overdosing can irritate. Hold the ear flap upright, place the applicator at the opening, and squeeze the measured dose while avoiding deep insertion. Immediately massage the base of the ear for 20 to 30 seconds so the drug reaches the ear canal and mite habitats. Clean visible debris between treatments and treat all pets in the home concurrently. You finish by wiping excess medication from the pinna, giving a treat, and recording the next application. Consistency ensures eradication. Monitor the ear for reduced debris, less scratching, and calmer behavior within 3 to 7 days, but complete the full course even if symptoms improve. If the ear shows increased redness, persistent discharge, foul smell, or the cat becomes lethargic, stop treatment and contact your veterinarian promptly. That can indicate secondary infection or medication sensitivity. Troubleshooting tip: if mites
Thanks for watching. Consider subscribing if I helped unscramble your problems.